All the same discussions heard at many of your homes. However, there's one thing we often discuss that would probably seem odd to someone who isn't familiar with our family or our situation. We often discuss bleeding. Let me start at the beginning so you two can understand the reasons behind the odd topic of our discussions. I was a normal kid, very active, always full of bruises, cuts, and scrapes. My mom's a nurse and was always cleaning me up. When I was 12, I had to have my tonsils out. That's where my being a normal kid changed. The surgery seemed to go perfectly. I went home, looking forward to all the Jell-O and ices I could eat. During the second night following my surgery, I woke and I was bleeding. I called for my mother, and she quickly rushed me to the surgeon's home. At that time, you could go to their house in the middle of the night. He assured my mother that it was common to occasionally bleed after the surgery, and he cauterized the spot from where I was bleeding. A few days later, I began to bleed again. And again, we returned to the surgeon. After that, things progressed as predicted, and within a week or two, I was fine. With 2 episodes of bleeding behind us, no more thought was given to the bleeding. I was a very competitive athlete through my school years. I was an avid soccer, basketball, and volleyball player, and I excelled in track and field. I often bruised with no explanation of the cause, but always attributed it to the fact that I was so active. I was fortunate enough to receive a scholarship to college for track and field, and therefore no longer played contact sports competitively, so much of the excessive bleeding subsided. My college years were uneventful. I had no bleeding, no bruising, no abnormalities in that area. I went for surgical pre-testing when I was in my early 20s because I had to have some cervical biopsies done. The day of the surgery came and went, everything seemed to go as planned. That was until the following night, just as with the tonsils. I began to hemorrhage. I needed to return to the operating room for the surgeon to stop the bleeding. I had bled so much that the surgeon recommended transfusions to bring my counts to a normal level. So after 2 successful routine surgeries and 2 episodes of hemorrhaging, it was recommended that I see a hematologist. After the testing, it was decided that I had something called von Willebrand's disease. This wasn't a terrible diagnosis. It could be treated with medication, factors, platelets, or even blood transfusions. I was going to be able to live a normal life and not have any major health concerns. I went on with my life feeling I was going to have everything I always wanted. Many years later, I was married, and the time we decided that came that we wanted to have our first child. We discussed the disease with my obstetrician, and he and my hematologist formulated a plan for my delivery. My baby was breech, and it was decided that a C-section was safer than trying to turn the baby for risk of tearing and bleeding. Von Willebrand's disease is odd in the fact that when you're pregnant, it brings your bleeding time back to normal to protect you and the baby. So the morning of my C-section, I was confident that everything was going to be okay. Unfortunately, when they did my bleeding time, it was over 13 minutes. So therefore, it didn't correct itself, so I didn't have von Willebrand's. So the concerns came, was it going to be an okay delivery? Was I going to bleed excessively? What were they going to do? Not knowing which diagnosis I had, I was very concerned and scared for myself and for the baby. The C-section went on as expected. I was given platelets and a medication called DDAVP prior to and following the surgery. I was also given both the medication and platelets 24 and again 48 hours after the surgery, the amount of time I had hemorrhaged after each prior surgery. The treatment was a success, and I experienced no excessive bleeding issues. Nicholas arrived into the world a healthy baby boy. However, we had no idea what my new diagnosis was. We were back to square one. I now needed to have extensive blood tests to determine the cause of my bleeding problems. The tests revealed that I had a platelet storage pool disease. Basically, my platelet count is normal, they appear normal, however, they aren't sticky enough. Therefore, if the clot begins to form, it's not held together long enough to control the bleeding. My history coincides with the disease. I learned the disease is genetic, which means I could have passed it along to my son. It was great to have a diagnosis, however, what would it mean for my future? Or for Nicholas's. Fortunately, at this time, Nicholas is negative and he doesn't have the disease. My future would bring 6 knee surgeries, 3 of them major, 7 wrist surgeries, 3 of them major, 2 C-sections, and a few minor dental procedures. Most of these requiring at least 23 hours in the hospital, infusions of platelets, DDAVP pre and post procedure with many, many bleeding times. So to this point in my story, I have received platelets 9 times. Fortunately, with the platelets and the clotting medication, I'm here to stand before you. Phase 2 of my story. My husband and I decided we wanted to have more children. We tried for several years with no success. We turned to a specialist who recommended IVF. Each procedure required pre and post procedure medication for my disease with platelets as needed. We were finally successful after 6 failed intrauterine inseminations and 3 full IVF cycles. We were told there was a good chance we were having more than 1 child due to my increased hormone levels. We knew this was a possibility, and we were prepared, or so we thought. At my next appointment, we were going to see the heartbeat. We waited patiently as the doctor pointed out the first heartbeat, then the second heartbeat, then the third heartbeat. Aww. Yes, we have triplets. Immediately, we were offered a reduction, learning that it's safer for the mother to carry 2 rather than 3. And with my clotting problems comes the additional risk of hemorrhaging. Immediately and simultaneously, my husband and I responded with, no. We want to keep what we've been given and just do what comes along. This raised issues with regards to my disease. Would I be able to carry them? Would I have any complications? What would the future hold? I was referred to a specialist who said that if I did exactly as he instructed, I would deliver my babies after 36 weeks and that they would be born healthy. Needless to say, I did exactly what he said. I had my first precautionary procedure done at 20 weeks. I spent time in the high-risk pregnancy unit on bed rest for 7 weeks. And the time passed very, very slow. But I was thrilled to know that the babies were receiving every chance possible to grow and thrive. We knew the disease was genetic and the possibility that 1 or all of the babies could have it. I was instructed to have a scheduled C-section. I arrived at the hospital for my C-section, had my pre-medications, and I went off to the delivery room. While I was in the delivery room, the room was packed. There was a nurse for myself, a doctor for myself, an OR tech for myself, and 1 for each of the babies of the following. So the room was just full of people. And I still, this whole time, was wondering what was going to happen with the babies. Were they all going to be okay? And we wouldn't know if they had the disease or any complications. But needless to say, my babies were born at 36 weeks, and they were all healthy. They came home at 4 days, 7 days, and 10 days. And they didn't receive any blood. We were nervous, though, because they still had to be tested. So the time came when they were 5, and 2 out of the 3 needed to have their tonsils out. That was the first time I had hemorrhaged. My brother's daughter had also hemorrhaged after her tonsils. So we had this big fear. Went and we took them to a hematologist who did extensive testing on them and found that they did have the disease, all 3 of them. And we had, when we went to have their tonsils out, they did receive the pre-medications and the precautions, and they had no excessive bleeding. Everything went really well. But knowing this disease, because we were prepared, we really alleviated the chance that that could happen. Catherine and Olivia had their tonsils out, and both of them had bruising around their face from the anesthesia mask. They had marks along their jawline from intubation. They had bruising on their thighs and their chests from the OR straps. And anybody knows if you've had surgery, nothing of that is tight. But we bleed. So we've been very, very fortunate that we have a very good hematologist for the girls, and we have all of you. I can't thank you enough for what you do selflessly, and you don't know where your blood is going, you don't know where your platelets are going, but I probably wouldn't be here before you if you hadn't been so generous, nor would my kids, because someday they're going to need platelets, and as a mother, I'm helpless. I can't give to my own children. So I just want to thank each and every one of you for being there and not knowing who is going to receive your platelets, but giving them anyway. It means the world to me, and I just want you to meet my kids.